Good morning. I'm Jim Robertson of Memphis, and we're doing another interview for the archives of the American Association of Neurological Surgeons. And on this particular occasion, it's at the time of the 1987 Semmes-Murphey Clinic resident reunion in Memphis. And this morning, we're going to be interviewing Dr. Francis Murphy, who is my former professor and one of the founders of the Semmes-Murphey Clinic, and the president of the American Association of Neurological Surgeons in 1965. Dr. Murphy was born in Macon, Mississippi, and subsequently went to Vanderbilt undergraduate school and Harvard Medical School, graduating from Harvard in 1933. And I think the audience should know that he subsequently became a neurosurgeon, and we'll talk about that in a minute. He became a member of the Semmes-Murphey Clinic. And he contributed in a number of original observations in cervical disc disease, carotid artery surgery, pain, nerve injuries, and so forth. And he rose to become the president of our society in 1965, as I stated. In addition, he was chairman of the board of neurosurgery, president of the Academy of Neurosurgery, held innumerable honors, which we will probably touch on today. Dr. Murphy, I think the best way to start the interview is to go back at the time you graduated from Harvard in 1933 and what was going on in your life at that time and how you became interested in neurological surgery.
I'd like to go back a little further about how I got to Harvard, which I think was the first real break of my life. My father, well, to go back, I went to Vanderbilt, and at the end of my third year, I was admitted to the medical school at Vanderbilt. I got home, and I was telling my father about it. He said, "No, dear, you've got to get your AB degree before you go anywhere." And he said, "Then I'll send you anywhere you can get in." Well, I was already in Vanderbilt, and the only place I applied was to Harvard, and much to my astonishment, I got in. And I believe to this day that the reason I got in was because I was from Mississippi, and they'd never had a guy from Mississippi before. And, of course, the faculty at Harvard was unbelievable. We had Otto Folin in biochemistry, who took the laboratory into the hospital with his numerous microchemical methods. Walter Cannon, who was professor of physiology and the originator of contrast media. We had Hans Zinsser, and professor of bacteriology, who rid the world of typhus and plague. We had Johnny Enders, great old Johnny Enders, who grew the polio virus that made polio vaccine, measles vaccine, red measles. I don't know whether, to tell you the truth, I don't know whether they have a vaccine for chickenpox or not. But at any rate, he got the Nobel Prize. Mount and Murphy got their Nobel Prize for the cure of pernicious anemia with the liver. And there was Dr. Cushing, who had started the neurosurgery at Hopkins and transferred to the Brigham as professor of surgery at the Harvard Medical School in 1913. Well, a lot went on between then and the time I arrived at Harvard in 1929. Dr. Cushing was still there, but he retired the year that, the summer that I was taking my clinical clerkship at the Harvard Medical School and at the Brigham. Well, at that time, surgeons had to retire at Harvard at age 62. So he had to retire in August of 1932. At that time, Bronson Ray was a resident, and I actually was the last medical student to operate with Dr. Cushing. I was substituting for Russell Patterson's uncle. And in the middle of the night, this kid came in with a choke disc and nothing much else. Dr. Cushing thought she had a third ventricular tumor. I'm gonna go back. When Dr. Cushing was at Hopkins under Halsted, Walter Dandy and Dr. Semmes were there as interns. And I think Dr. Cushing had the idea of air studies, but I'm not sure of this. But at any rate, he and Walter Dandy were in a constant feud about who discovered this. And Dr. Cushing wouldn't use it. So we explored that girl without an air study, and it was negative. And I saw Bronson Ray some years later, and he told me he had followed this girl for a long time, and that she undoubtedly had a pseudo-tumor.
I'll see.
That's the first. And I was there the day Dr. Cushing had left, the day that Dr. Cushing left, and half the Brigham staff went down to Cornell, among them Bronson Ray, to staff the new New York hospital. Dr. Hoyer had been at Cincinnati, and he was brought to New York as a professor of surgery. He was the second to the last resident of Halsted at Hopkins. The last resident was Marty Reed at Cincinnati. Of course, neurosurgery, Dr. Cushing had just finished his 2000 brain tumors. Now, the way he would operate, somebody might be interested in this, Gil Horax was his assistant. And Gil would come in and turn the flap while the old man was at home dictating on one of his various books, such as the biography of Osler. He was a hard taskmaster, but he was fair. And he worked harder than any of the interns or students. I might add that he had a form for history and physical. And you had to be certain that everything was in its proper place. It took exactly 6 hours to wake up one of his patients. And if you had anything out of place, you had to do it all over again. So there wasn't many mistakes made in those days. Well, at any rate, he was quite an inspiring man. And later, he promised Bert Dunphy and me an internship, but he retired before that could be fulfilled, and that was the second greatest break I ever had in my life. I went to Chicago, got an internship at Chicago, where Dr. Percy Bailey was professor, and he is the man that had classified brain tumors for Dr. Cushing. Paul Bucy was his assistant, and Earl Walker was the resident. And Earl was working on the thalamus at that time, and I said, Earl, you go on work on the thalamus, and I'll run the service. And that's what happened.
Awesome. How did you get down from there to Dr. Semmes?
Well, Paul Bucy was a good friend of Dr. Semmes, and Dr. Semmes had told Paul that he wanted someone to train himself. He didn't want anybody else that had trained by somebody else. And so I got on the train and came to Memphis and got the job, and that was a terrific break so far as I was concerned, because I came from Mississippi and I wanted to live in as close to Mississippi as I could in a place that had a medical school. Now then, at that time, the University of Mississippi had 2 years of medicine. So Memphis was about as close as I could get to Mississippi.
Well, you all had an exciting lifetime together, really. I think people would sort of like to know how you came upon the syndrome of the C7 root and describe the whole picture of the herniated soft cervical disc.
Well, Doc Semmes' closest friend was a surgeon from Helena, Arkansas. And he had been trained at the old Cryo Clinic. This clinic blew up in 1929, and the reason I remember that date so well was that Barney Cryo was in my class at Harvard. And there were a lot of people killed in this explosion. And Dr. Betz, who had trained there, went up to the funeral of his friends, and while he was there, he developed this terrible pain in his arm and in hand and shoulder and to his chest. He was committed to operate the day he came back from the funeral, and he said to me, "Murphy, I goddamn near cut that woman to pieces." And the same day, he found out he couldn't write and that he couldn't shave, and that set me on the track of writer's cramp. Well, that's a long story, but to get back to how I found out about ruptured disc, I had thought that I knew what we might find if we ever saw one. And I told the residents about it, and a boy by the name of Fox, who was a resident in Camel's Clinic. In those days, we took the resident at Camel's Clinic for 6 months. What's happened to that, I don't know. At any rate, Fox called me and said, "I think I've got your man." So I went over there, and Dr. Fox showed me this man, and he was an old white painter who was in agony. And after I examined him, I said, "Well, I think I know what's the matter with you, but I want you to know that this has never been done before. And if you're willing, I'll operate on you in the morning." He looked at me and he said, "Dr. Murphy, you can cut this damn arm off if you'll stop the pain." I said, "I'm the man. You're the guy I'm looking for." Well, and I called Bill Betz, and I said, "Bill, I've got a man here that I'm going to operate on in the morning that I think's got what you've got." And so we operated on this man, and Dr. Semmes and Dr. Betz were looking over my shoulder when I pulled out that soft fragment of disc from under the 7th cervical nerve root. And that was the beginning. And it's an interesting thing that 2 out of the first 3 we had were doctors, and each one of them thought that they had had a heart attack.
I can remember one of them was Rudy McCormick.
That's right, and Dr.
He
McCormick,
was up there in an oxygen tent
yeah,
when he went and got him out.
Well, Bob Taylor, a doctor here in Memphis, told me that he was cyanotic. It hurt him to breathe. And he put him in an oxygen tent, and I think it was the late Dick Chang said, "This man does not have a heart attack." And then they called us. And we took him out of the oxygen tent and operated on him. And that was the beginning.
Yeah, he was a very grateful man. I can remember him telling me the story. Then the Semmes-Murphey Clinic grew, and you added Dr. Schultz and Desaussure and subsequently others, including myself. And then you became interested in the carotid artery as early as 1949, as I understand. And then subsequently, I think the country knows what you contributed in terms of indications for and the surgery of carotid occlusive disease. What seemed to interest you, what got you interested in stroke so intensely? Because at that time, it was sort of foreign for a neurosurgeon to be interested in a stroke.
Well, we had a woman that had an aneurysm on what had what I thought was an aneurysm on the left carotid artery. And in those days, I was ligating the external carotid artery. Not the I mean the common carotid artery. We had found before that ligation of the internal carotid in the neck carried too high a risk of a stroke. At any rate, I ligated this common carotid, and she went home and bled again. And in those days, we were doing arteriograms by opening up the neck and putting the needle in under direct vision. Well, I reopened the neck to do another arteriogram on her, and I was fumbling with the carotid artery, and I knocked off an embolus. And she was on the local, she immediately became hemiplegic. And after I got my wits together, I opened the artery, and lo and behold, this long clot was blown back from the pressure from the other carotid across the sacrum into the one on the left side. And she recovered most of her function. But I should say that in about a week, by God, she bled again.
Oh, no.
And when she died, we found that the aneurysm on the carotid had not bled, and there was one on the middle cervical on the other side that had bled. And I made up my mind that I was never going to make that mistake again. So I got out all the multiple aneurysms that we had. There were quite a few, I don't remember how many. But at any rate, after going through a lot of cases, I finally found out that there were three things that you should see before you be satisfied that that was the aneurysm that bled. Now, one was the secondary circulation on one or top or bottom of the aneurysm, which was the point it had bled.
Subsequently known as the Murphy tip.
Well, somebody else put that on it. I didn't. We also found that there was so-called Basler Spasm, which I don't believe is spasm, and I still don't believe is spasm. And displacement of the artery from which the aneurysm arose by the clot which had formed underneath the artery. Well, I think subsequently this has proved to be a pretty good way. Now, it's been 15 years since I retired, and I don't know what's going on in the identification of bleeding aneurysms. Perhaps you might know.
Well, with the 3 points that you just made are still the classic ways that we tell if an aneurysm has bled. Sometimes a CT scan will show the bleeding only at that site, and this has been an addition to it, but very few other comments I can make, except the addition of the technology has made it possible to actually see the most clot and to pick that aneurysm as a bleeder, but still you go through those criteria to decide which one to operate on. Now, as I recall, you came back from some meeting someplace in about 1954, all excited about carotid stenosis, and immediately began to do carotid endarterectomy. And you used to joke that you were opening arteries on Monday, that is carotid stenosis, and tying them off for aneurysms on Tuesday. And you did do that on a number of occasions.
That's essentially what I said. But you must remember that almost without exception, symptoms from carotid stenosis come from the internal carotid. And symptoms from, well, at any rate, I found out that you could tie off the common carotid, and we always measured the pressure above the ligature to see whether we were doing any good in it. So Jeffrey Jefferson started doing ligations of the common carotid for aneurysms about the time I started ligating them too. And we had pretty good results. At least I thought they were good. But we had already found out that if you ligated the internal carotid, you were headed for trouble.
I think I've seen that over and over again. Well, at any rate, during the 50s and early 60s, you went ahead with developing the criteria for the approach to the patient with carotid atherosclerosis. As I recall, you popularized the theory that it was the emboli that were causing the transient ischemic attacks, and you subsequently wrote up one of the first series of successful surgical treatment. And then you had us get into the cooperative studies, both of the occlusive disease study and the hemorrhagic study, and as far as I'm concerned, you foremost, and maybe Steve Gurdjian secondarily, were the two neurosurgeons that sort of led neurosurgeons into the field of occlusive vascular disease.
Well, there's no doubt that Steve, who was a great man, I heard that he died last year, but he was a terrific guy. And we were friends all through the years. At that time, or about that time, the Princeton conferences on cerebrovascular disease had been started by a man named Wright under the auspices of the NIH. I've forgotten who was head of it, but Murray Goldstein subsequently became head of it. At any rate, there was an argument at that time, and it's still going on, as to who should do these things. Well, at one of these conferences, Dr. Charlie Robb, who was head of surgery at the Rochester Medical School in Rochester, New York, got up and said, after I'd given a paper, that he didn't think brain surgeons ought to do vascular surgery. And I got up and said, Dr. Robb, I'm ashamed of you. Don't you know this is the easiest operation a neurosurgeon does? Well, I didn't have any more trouble with him.
Well, we've got to get back to our conference. I guess we ought to move up to what went on when you were president of the then Cushing Society, I guess, and or had the name been changed when you became president? No. Or did you change the name? I've forgotten.
Well, I changed the name. At least it was changed during my administration. But before that, I think you should know something about what happened at a program committee meeting of the Cushing Society. I think this is correct. I think I had proposed the idea that breakfast seminars should be given at the Cushing Society meeting, and I got the program committee down to our duck camp and got them drunk on Dr. Semmes' old Joe Blackburn whiskey, and they agreed to have 2. And I'd already approached Dr. Wilder Penfield and Barnes Woodall about that, and they had agreed. And when this got back to the board of directors of the Cushing Society, they vetoed Dr. Penfield. And Barnes said he wasn't going to be the only one. So it fell through, and I think it was 10 years before Mayfield and I started running the Cushing Society. And I think that was when the breakfast seminars started.
And that subsequently spread as a fairly common thing now, I think.
Well, we weren't the only ones. I don't mean to say that was original with me, because Harold Boyd had told me they had him at the Academy of Orthopedics, and I think Dr. Ellett, who was a Memphis man, had started him at the ophthalmology meetings.
As I recall, in your presidential address, you addressed the issue of neurosurgeons' exposure to medical students. That was one of the things that I remember. I'd like you to know that it's still extraordinarily difficult to get any place on the curriculum to teach medical students about neurosurgery. You also it was very important at that time to have one organization proclaimed as the spokesman for neurosurgery, and you and Mayfield had a lot to do.
Well, we did it. Somebody, and I don't recall who it was, conceived the idea that if we were going to get anywhere with reorganization of the Cushing Society, that we had to get the cooperation of the other neurosurgical societies. And Gordon Vandernoort from somewhere in Pennsylvania outside of Philadelphia was president of the Congress. They were the ones that were holding things up. And we finally got Gordon to agree with this. And if it hadn't been for him, we never would have gotten the old Cushing Society into the new American Association of Neurological Surgeons. Well, at any rate, he, I think, more than anybody else, made this thing go.
Well, that's news to me. Gordon was always a friend of mine. He's delighted to hear that. I guess your experience with the Cushing Society, or the American Association, really reached its peak at the time of the Atlanta meeting when you were given the Cushing Medal. Only a few people have received that medal. It's my understanding it's going to be given to Bill Meacham this year.
Oh, really?
Yes, he's a real Southern gentleman and a wonderful guy. Would you make a few comments about how you felt being awarded the Cushing Medal?
Well, of course, I was highly honored. There's no question about that. And I was in a distinguished company. That's another thing that I thought about. But it was pretty emotional so far as I was concerned.
Well, it was a terrific day. Well, I want to thank you for the interview, and all of you.
One more thing I want to say.
Right away.
It is about my experience in the Army. I was finally assigned to O'Reilly General Hospital in Springfield, Missouri, as chief of neurosurgery. And I was sent a bunch of people who had gone through the 6-week course in neurosurgery. And one of them was John Kirkland, who I think is the smartest man I ever saw. And I'll tell you one little incident to prove what I'm saying. I wanted him to go into neurosurgery. His father was head of X-ray at the Mayo Clinic, and he went back. He said he wanted to go back to the Mayo Clinic and start the heart section, but that he wanted to work with Bob Gross at the Brigham and Children's before he went. So it so happened that Bob was a class ahead of me, and we were good friends because we played squash and basketball together in the afternoons. So I called Bob and I said, I've got a character here named John Kirkland who would like to work with you for a year. And he said, of course. John Kirkland is noted as the smartest man that ever graduated from Harvard Medical School. And I was telling one of his residents that this year, in The resident said, not only that, but he probably still is the smartest man. Graduated from that school. And I believe it. He's done a magnificent job on Alabama, and he's made it one of the great medical schools of this country.
There's no question about that. Well, at any rate, we thank you very much and wish you well, and I'm sure that this will be a treasured interview in the archives.